I'm Dr Nighat, an NHS GP with a specialist interest in women's health. The book is called The Knowledge, Your Guide to Female Health from Menstruation to the Menopause, and it literally is that, what it says on the tin. It's your guide for the natural transition that a woman and girl goes through from puberty years to fertility years to the midlife and beyond. It was a book that I carried around in me for about a decade. I've been a women's health specialist for about 10 years, and I was accumulating knowledge that I was looking at in my practice and seeing these women with different conditions, but also from women all different walks of life. And I hope that this book achieves, as a starting point, a conversation to say, talking about periods isn't taboo, to know that pain is not normal with your periods, to understand that there are treatment options for endometriosis, and also there's a condition known as adenomyosis, and also to understand that women have choice over their bodies when it comes to the menopause, and it isn't something to be put up with because it's normal and it happens to everybody. I want women not just to survive, but I want them to thrive as well at all different stages of their life. I'm hoping they'll take away hints and tips, but also hear my voice as a clinician in there. There are sections that even when I was reading it out loud, it made me laugh. Mainly because medicine should be fun, looking after our bodies should be fun, and also education shouldn't be really boring, because this is normal stuff that happens to 52% of the population that walk on this earth. And so female health isn't just limited to women in our lives. This book is for men to read. I'm a mother to 3 boys, so I really want them to know what their mother is going through. This is a very selfish point. I want to empower the men in my life. I have open conversations. My 5-year-old found my tampon in the bathroom and he asked me what it was, and I said to him, even though he's 5 years old, this is something that mummy uses for her period, and period is something that happens to all women, and it's when the lining of the womb comes away. Now, he might not have taken too much on as a 5-year-old, but I didn't want to hide it and feel embarrassed about it. Why should it be a taboo and a stigma? And I want the men in my life to understand that and know that it's normal. And for too long, we have hidden so many conditions away. And when something is hidden away, or it's put under a blanket, or it's shameful, or in my language we say kapde ke niche, so it's underneath the carpet in the household, then actually what happens is that there's so much misunderstanding, and too many people put up with too many symptoms that doesn't actually empower us with the knowledge to do further things like research, or understand the people that we're working with, or understand the people that we're living with in the same household. I want this to sit there on a coffee table, anywhere, in any setting, unabashful, to say this is a conversation starter. I'm really hoping that people will open it and then go to that point that interests them, put it down, come back to it when they're ready, but also whatever they learn, that they sprinkle it around like confetti. They don't keep it to themselves. The knowledge that I share in the book, actually, it's not mine now. It's for you to take on and share amongst your communities. It's for everybody. It's got lots of chapters on trans health as well. It's for the men in your life. It covers a whole generation. So it starts at puberty years. So it's appropriate for anybody above the age of 12 all the way up to about 100. I wanted this book to be fully illustrated. And that really because when I was a medical student studying medicine at Barts in London many, many years ago, all the medical books that I would open would have either line drawings or would default to white Caucasian skin. So I never really knew what vulval lichen sclerosis or what vaginal atrophy looks like on darker skin tones until I started seeing patients in my clinics. Also, this meant that, unfortunately, if you don't know about these conditions, then you'd end up getting a misdiagnosis, which could detrimentally impact a patient's life and their well-being as well. So the reason I wanted to be illustrated is because once you see something, you think that that relates to you, especially if it's something that is on the same skin tone as you or someone that looks like you. You're more likely to form familiarity with that. I saw that within my social media. Once I started making social media content and I was talking about vaginal dryness, vaginal atrophy, I was talking about periods, I was talking about endometriosis, adenomyosis, I was talking about miscarriages on my social media channel. The biggest response I got was that there's a woman in a hijab talking about vaginal dryness. And I know that that's crazy, but once you see someone that looks like you, talks like you, represents your community and speaks in a language that you discuss things every day, It makes it more attainable, and also it makes it more relevant to your health to feel, I need to take notice of this. And that's what I want as a GP. So with having illustrations in there, I could see me as a woman of colour in there, but also having illustrations of women who wore hijabs and women who don't wear hijabs from different ethnicities, from marginalised communities. I wanted illustrations of trans health in there for those that are transitioning from female to male, because they'll still have period problems that want to be dealt with, and we don't do that well currently in our healthcare system. My whole purpose as a doctor is to prevent health conditions from occurring and then treat them. So as a doctor, what I really wanted with the pictures was that people to see themselves, to be able to be empowered, and then go to their own healthcare provider and think, I think I might have vaginal atrophy, and these are the treatment options in the book. Could you please discuss this? And that's the whole point, starting conversations. The Knowledge is available now from all good bookshops.